Hi everyone, Luke here from Luke Training. So tonight I'm going to do a video on how to use an automated external defibrillator. Widely accessible to the public now, normally on the side of shops, leisure centres, police stations, fire stations, ambulance stations, so they're everywhere now, and they increase the chance of survival. So the main cause for adults to stop breathing and need a defibrillator is sudden cardiac arrest, or also known as ventricular fibrillation, basically where the heart is in chaos. The quicker we can apply a defibrillator and use it, the higher the chance of survival. Every minute without a defibrillator attached to a casualty, their chances of survival deteriorate by 10%. So the quicker we can use one, and the more people that know how to use them, the more chance of survival a casualty has. They're very simple and easy to use. So once you turn them on or open their lid, they will start to give you instructions on how to use it. So follow the instructions that are given. The defibrillator will decide on whether to shock the person or not, and it will also decide on the strength of shock to use. And what it won't do is it won't shock a living person. So there's nothing to worry about. There are a few things to consider when using a defibrillator, such as bystanders. If they're touching the casualty, when you press that shock button, unfortunately a residual shock may pass through them. Metal as well, being a conductor of electricity, we want to avoid touching any metal once we're pressing the shock button, and making sure everyone is stood clear. We're trying to operate with a clean canvas, so when we do remove clothing by either unzipping it or cutting it off, we're going to give ourselves a clean canvas. We're going to remove any jewellery out of the way, any medication patches, and we're going to be mindful of any implants such as pacemakers or internal defibrillators, and all that will dictate is where we put the pads. So we're not going to try and cover anything with pads. For example, jewellery, piercings, really common now. We're not going to spend time trying to unscrew piercings, we're just going to make sure the pads aren't covering them. And then there's always the hairy men out there. Hairy chests, we want a good seal with the pad to the chest and the rib cage. So any hair there, there is normally a razor within the defibrillator pack. So we're going to shave the patch where the pads are going to go, and we're going to place the pads there. And as I said, we're going to follow all the instructions given by the defibrillator. So watch out for the full demonstration, and hope it's helpful for you. If you do like the video, feel free to share it amongst your friends. Feel free to subscribe to our page and wait out for further videos. Thank you. So as soon as the defibrillator arrives on scene, the first thing we're going to do is we're going to start preparing the casualty by removing any outer clothing. If we're fortunate enough and they've got zips on, we'll unzip their clothing. For inside each defibrillator should come a pair of tough cut scissors, in which we would cut any clothing off. And this includes bras, because obviously some bras have underwire to them. Once we've removed the clothing, we're going to have a look at again we're looking to try and create a clean canvas. So we may need to remove any jewellery over the shoulder, any medication patches, and just be aware of any sort of implants that may be there, normally indicated by small scars under the collarbones when it comes to things like pacemakers. Depending on if there are such implants, we may have to change where we place the pads, and we just go for the other side of the chest. So once we've got a clear canvas, we're going to remove the defibrillator and turn it on, and it will start to give us full instructions.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
So remove the pads from the silver packaging. As we can see on the pads, they give us pictures on where they need to be placed.
Plug in connector. Do not touch the patient.
Again, reinforce these prompts for bystanders. Don't touch the patient.
Advised.
Once it's analysed the heart rhythm, it's going to say shock advised, and it's going to start to charge.
Stay clear of patient.
Again, reinforce, stay clear, don't touch the patient.
Deliver shock now.
And as we can see,
the orange button now.
The orange button's flashing. We press this.
Shock delivered.
And the shock would be delivered through the casualty.
Begin CPR.
Once the defibrillator advises CPR, we continue with that, and the defibrillator will then reassess the patient's heart every 2 minutes and either advise further shocks or no shock advised, which would then indicate that normal heart rate has resumed. As I said, very simple, very easy to follow. Not much differences between the brands. The pads might be slightly different, and they may operate differently in such that some you have to turn on and some start as soon as you open the lid. But as I said, they're very simple. Follow the instructions and you can't go far wrong. If you have any questions, feel free to get in touch with us. And as I said previously, if you like the video, feel free to share it amongst your friends, and hopefully this has offered you some confidence in using a defibrillator. Thank you.